Welcome to Health Professional Radio. I'm your host, Neil Howard. So glad that you could return for another segment. In this segment, we're going to be speaking with Dr. Roger Levy from GSK as a global immunology and specialty medicine expert to talk about the results of a global survey of rheumatologists, nephrologists, and internal medicine specialists, which showed that the COVID-19 pandemic and other factors prevented some people living with lupus from getting optimal care in the past couple of years, increasing their risk for organ damage. Welcome to Health Professional Radio. Dr. Levy, thank you for joining us this morning.
Thank you, Neil. It's a real pleasure to talk to you and your listeners about such an important topic.
Well, I did, of course, mention that you're joining us here from GSK. Give us a bit of insight into your professional background briefly and talk about your role at GSK.
I'm a rheumatologist. I trained at Hospital for Special Surgery in New York in the 1980s, and I'm originally from Brazil. So after my training, I went back to Brazil and started to work with lupus mostly and other autoimmune diseases that are similar to lupus in the rheumatic area, the rheumatology. And I was teaching at the State University of Rio de Janeiro for 23 years until end of 2017 when GSK invited me to join the company to work related to what I was doing before from another perspective now as a director in medical affairs. We call it the Global Medical Expert. So I do a lot of external and also internal trainings and presentations, engagements, scientific production, and we oversight the clinical trials and we analyze the results. And we are focusing on the improvement of the lives of people living with lupus. Mm-hmm. And that's it.
Well, what was the purpose of this survey that targeted healthcare providers who are treating lupus?
Yeah, so this was a survey that involved almost 650 healthcare providers in 7 countries, including the US and China, but also Japan, and also 4 European countries, Germany, Spain, France, and also Canada on this side, and involving not only rheumatologists, there are the primary physicians that take care of lupus, but also nephrologists and internists as well. And the idea was to learn how much the COVID pandemic impacted in the care of lupus patients, and the results were quite interesting. And also how much the damage, which we know happens in almost all of the patients, if we talk about 20, 25 years of follow-up, how much that is communicated and how much patients understand about the risk of damage and what can be done to delay, and if possible, even better, to avoid this damage accrual that we know is irreversible.
So what were some of these findings and what are the implications?
Yeah, so what was shown by these results was that the COVID pandemic kind of exacerbated issues that were already happening, so delaying even more diagnostics. So people that have signs and symptoms and don't recognize the disease, so that delays their treatment, their understanding of what's happening. So with COVID, this delay that was already happening before COVID got worse in terms of time and understanding and access to treatment. And also it delayed people that had already been diagnosed in pursuing a proper treatment because they were afraid of catching COVID at the hospital. So they missed treatments, they missed clinical visits, lab exams. So that kind of created even more difficulties in the treatment of lupus patients. And also physicians said that this was difficult for them because they were, all of the physicians, overburdened, and other healthcare professionals too, nurses and others, overburdened with the COVID pandemic and the need to cover for those patients. So they had to divide their time, work longer hours, so they couldn't dedicate as much to the patients with such chronic diseases such as lupus.
Now, you mentioned that there were some compliance and follow-up issues long before the pandemic. For these people that are dealing with lupus, what was the main factor that caused them to miss appointments or not seek treatment before the pandemic?
Right. Thanks for asking. This is something that we always wanted to improve, because we know lupus is in between the frontier of a rare and a not so rare disease, but it's still not common. It's a disease that affects mostly young women on their first manifestations, and it's widely variable. It's very rare to see two patients that are exactly the same, even within the same family. So they can present manifestations that could lead them to see any different type of specialist, from dermatology to gynecology to endocrinology, and I could list all the specialties. And sometimes the specialist is paying attention to what the patient is complaining, but not looking at the overall picture and deciding that this could be lupus, and we need to investigate further with laboratory autoantibodies mostly that will confirm or discard the diagnostic hypothesis, or even diagnose a similar disease that can have overlapping manifestations, which could be related to lupus and not be lupus itself. So we know the longer it takes to confirm that this is the diagnostic of this patient, the longer it will take to start a proper treatment and to find that this patient can get into a better disease state, control the disease with a lower disease activity or remission. So sometimes this delay will have patients arrive to the specialist already with the damage. So we have disease activity that, if it's persistent, will lead to damage. And the damage, like we said, is irreversible, and it impacts the quality of life, all aspects, social, economic, and family planning. And also, when there is damage, the risk of accruing further damage is increased. And unfortunately, this will also impact the rate of mortality. So the more there is damage, the sooner the patient is likely to die from the disease and complications of the damage too.
What can healthcare providers do, or what can they say to their patients once they reconnect with them and kind of, I guess, bolster the importance of continuing their care? And what can they say to those who they may think might have lupus?
So two main messages. One for the physicians and healthcare providers in general to think of lupus. It may not be your first diagnostic hypothesis, but it should be on the list, at least top 5 or 10 if we're talking about a young woman with general symptoms that has most commonly skin and joint involvement. Think of lupus, order ANA test, refer this patient to a specialist that could confirm or discard this diagnostic and offer patient not only the treatment but the education about lupus. And for the patients and the community and their families, the importance of the compliance and adherence to treatment, of asking your healthcare provider any question that comes to your mind, understanding that the treatment is chronic. That means it's for the lifetime. Our objective is to control the disease, to have the lowest possible disease activity, and if possible, remission for the longer duration. But we need to have the patient as a partner and not as a victim, understanding why they should change life habits. They should adjust their lives to the treatment and, of course, comply with the treatment. And if they decide this medication or that is not causing me a good effect, I don't like the side effects, talk to your doctor, talk to your healthcare provider, and there are always going to be other options for treatment that will let you live closer to a normal life and be able to do the activities that you like to do.
Well, Dr. Levy, is there a website where our listeners can learn more?
If you go to us.gsk.com, you'll be able to find more information about the survey.
Well, Dr. Levy, I appreciate your time. Thank you so much for joining us here on Health Professional Radio.
Thank you, Neil.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Roger Levy. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at Anchor, Spotify, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.